Hello, everybody. This is Dr. Cedric Alvarez here at Enhanced Dental. I'm very excited to share with you the newest acquisition we have here at our office, the latest technology that's out there. Part of our promise to our patients is to provide the latest in our field to provide you with the best care. So what you see here in front of you is our CBCT unit, which is a 3D X-ray scanner, top of the line. This particular one from Vatech is extremely efficient, which is why you see the green CT on there. Very minimal radiation, excellent images, and it just gives us a whole lot more information to help us diagnose things better and therefore provide better dental care for you, our patients. So what I'm going to show you here first, this is the image that we would obtain from our previous x-ray unit. This is a beautiful image, very good detail, made by the same manufacturer, Vatech. And this gives us just a lot of information about things like bone structure, tooth positioning, number of teeth, sinuses, nasal passage, etc. And this is a really good image. And we still use this image, and I still use this image here in office. And as a matter of fact, this machine can still produce this same image, actually even a little bit better quality. But now I'm going to show you what this new machine is capable of. And the analogy I like to use is comparing a photo to a video. A photo is 2D. It gives you some good information just by looking at the photo. But when you watch a video of the same scenario, you get a lot more information from it. Same idea. So here we go. You can see here the what this machine can produce. So you'll see here I can take the image and I can rotate, I can change things, I can change viewpoints on this model here on the bottom right. And what I can then do is I can double click on something and it'll zoom in right where I want it. Now you can see there's slices, what we call slices, on the other 3 frames here, and this gives me a view from the side, a view from the top, and a view from the front of the area I want to see. But it's a really cool technology. What it allows us to do is just see things in a much clearer picture, and so we can take these images and just do so much more with them and just get so much more better information that I can use here in office or even share with colleagues. One of the things I did want to show you here is an example of what we're talking about. So you can see here, this is a tooth from the old type of x-ray. And you can see a circle there at the top. And what I've basically done is kind of highlighted a suspicious area. This looks like, oh, there's maybe some kind of infection going on in this tooth here. And our patient was complaining of pain. And so I said, okay, let's go ahead and go get this checked out so we can maybe get something like a root canal done to treat this tooth. And so what I ended up doing was sending to a specialist. The specialist ended up taking a 3D x-ray. So this is a view of the tooth from, if we were looking, say, from the front of the tooth, where, say, the nose is to the throat, that direction. And what I did here is I highlighted the infection here for you. And you can see this infection is not small at all. This is massive. This type of infection will have a very poor prognosis in terms of a root canal, and this is something that this 3D technology allows us to do. And this is just one of many different examples, but I just kind of wanted to show you what a possibility is that occurs in every day in a dental practice. Now, if we go to another view here, I really like this view. This is actually something unique to this machine. One of the reasons I went with this particular machine here is you can see right around this tooth, you see this little green area in between the tooth. And this is actually my scan. These are my teeth here. And you can see there on the right-hand side, I'm kind of tracing it out, but that is a simulated implant. So, for example, if somebody was going to pull that tooth on me, and replace it with an implant, we can now take this image, put a representation, exact dimensions of the implant, spin around it 360 degrees, make sure we have enough bone to support the implant, and then we can take this and actually plan the surgery out before we even get to the surgery itself. And so we have a great idea of the potential for the area to be restored with an implant. So it's, again, really cool technology. We're really excited about it, and we're going to be looking forward to really implementing this and giving you the better care that you deserve. Oh, before I forget, there's one other really cool feature that I did want to show you here, and this has to do with what we call airway. As we all know, sleep apnea is becoming more and more of a problem. People hesitating breathing at night. And so you can see what I've done on myself here is I've actually highlighted my airway. And, blue, green is good, yellow is good. Anything that gets darker than a yellow is an area of concern. But I'll highlight, for example, my soft tissue, my skin, things like that, and we can kind of peel that away so we can kind of get a look at the relation of the airway to certain things, spine, things like that. But we can see people who have very constricted or very tight airways that make them more predisposed to something like sleep apnea. So again, just a couple of examples of what we're going to be able to do here. So again, super excited. I'm going to include a link here for the machine itself. If you're interested in clicking on it and seeing some other examples, you can click on that link there. Here's the information for our office. If you like to make an appointment, we'd more than love to have you here. Thanks so much for listening. Have a great day.